So as a GP registrar, I'm currently in the SCA exam pathway of my journey, and I feel like SCA exams can really make you question your skills. For those of you who don't know, SCA exam is the final exam of the MRC GP pathway, and the exam is heavily based on how you consult. This exam really tests you as to how you're actually coming across. What I mean by that is how you actually come across to patients. It's not just about what management plan you're giving. It's basically about what your mannerisms are, how you're communicating, what words you're using, how you're phrasing, and that really can hit a little bit deep. The reason being because if you have a knowledge gap, it's easily able to be fixed, by going and reading guidelines, by reading books. But if there is a way you communicate and that's quite natural to you, how do you tend to fix that? And that really hit me quite hard. And I think what I realized was this is where the communication differs between British and internationals, because while we all mean and want to do the right things, we want to treat our patients right, sometimes the way we speak comes off as quite direct to them, and sometimes it's perceived as rude. Something we don't even sometimes notice it. Now, for example, I speak 6 to 7 languages. So for me, if I would translate a phrase from Russian to English, for example, it will come off as really rude, although that's not my intention. Same thing would happen if I would translate something from Hindi to English. And I think all of us, because English is not our native language, at some subconscious level, we are actually translating those phrases and saying it in English to our patients. And sometimes that can come off as rude. And that's why it gets so difficult, because you've always been speaking like this your entire life. And for the first time, somebody's telling you, oh, that is actually very rude, although that was not your intention at all. So that is where the learning happens, and where you kind of have to think about, okay, who you're speaking to and how you're basically phrasing. So what I'm trying to say is we technically say the same things like my British colleagues, but it's just the way we come across. So I'm going to give you some examples from the top of my head. Sometimes we just say directly, I think you should do this first. Whereas one of my British colleagues would say, what I suggest is, how about we try this first? Saying the same thing, but listen to the tonality and the way you kind of sound. Or something like, I need to ask you about your mental health. Some of my British colleagues would be, would you mind if I ask you a few questions about your mental health? Saying the same thing, the way we sound is different. Or sometimes when there is a bit of a disagreement with patients, you say, look, I don't think I agree with this. Or one of my British colleagues would say, I think today we'll have to agree to disagree. So saying the same thing, but in a different way. And you can see how soft and subtle it is, the way actually they talk, and patients are used to this. And I notice it happens to me, especially when I'm consulting and in my head where I'm kind of thinking about the diagnosis. I naturally revert to my normal way of speaking, and some phrases that I say comes across as quite direct. So every single time I practice a case with my colleague, I record myself, and then I do the post-mortem of that. Basically looking at myself without thinking and seeing, oh, what are the words that I'm saying, or how am I phrasing it? And then really tweaking that to actually sound a little bit more subtle, the way they're actually used to. It is kind of funny because at one point I thought, hold on a minute, if I actually speak like this to somebody who I know, like my wife or my colleagues or my brother, they'll be like, what the hell's wrong with you? Like, it's like you're a completely different person. And actually it is true that when you're actually speaking in that kind of a mannerisms, you actually turn into somebody else. And at some point, maybe we want to kind of reject it and say, oh, this is not who I am. And I do that as well. To be honest, I think it's a brilliant skill that GP training teaches you, because I think communication skill is one skill that can be used in any different aspect of your life. So communication doesn't just mean just talking. It means that you actually speaking to that person at their level, understanding where they're coming from, what they believe in, and how they actually perceive words and phrases, so that you can actually impact and actually influence people. Communication is used heavily in the business world and even in politics. They use a very diplomatic way to talk without offending anybody, but actually getting their points across. That is why the tongue is so powerful, because words are sharper than the sword. They cut really deep. And I think GP training is probably the only place where such high emphasis is placed on this skill. So I'm just continuing to learn and do a post-mortem every single day. I'm an IMG doctor currently living and working in the UK, and I share my journey through money, medicine, and life in the UK. So if that resonates with you, then follow along.